In the next few minutes, you will learn more about the care and cleaning of the treatment units Primus 1058 Live and ESTETICA E50 Live. Here's an example of ESTETICA E50 Live. You have the option to view the complete hygiene video or select specific parts, such as in the morning, after treatment, in the evening, weekly, and cleaning if required. In the category Cleaning if required, a selection of the Up Dekaseptol Gel, Up Oxygenal 6 as well as Amalgam separator is possible. At the beginning of each working day, switch on your treatment unit by pressing the On/Off button. If the cleaning program was selected the night before, it starts automatically in the morning. After switching on the treatment unit, make sure that the instrument tubing has remained in the germ reduction attachment overnight. Now every instrument and suction hose is automatically rinsed for 2 minutes, in accordance with the guidelines of the Robert Koch Institute. Once the cleaning program has been completed, you can remove all instruments and suction hoses from the germ reduction attachment and place them back in their position on the dentist and assistant element. Then remove the germ reduction attachment from the spittoon bowl. Prepare your treatment unit for the day and equip the dentist and assistant element with the instruments required for the next treatment. After disinfecting the instrument tubing, including instruments and suction hoses, remove the detachable instruments for disinfection. Please note the instructions for the respective instrument in the care instructions. For cleaning and disinfecting surface, instrumentation and suction hoses, please use KaVo approved disinfectants. Clean the assistant element and start the cleaning program 01. Place the sterilization attachment on the spittoon bowl and plug the already cleaned instrument and suction hoses into the corresponding adapters. Now every instrument and suction hose is automatically rinsed for 20 seconds in accordance with the guidelines of the Robert Koch Institute. Once the cleaning program has been completed, remove the instrumentation and suction hoses from the germ reduction attachment. Place them back in their position and take the attachment from the spittoon bowl. Use disinfection wipes to clean the upholstery of the patient's chair. The dentist element. The arm system. The treatment light. The monitor. The unit body including the spittoon bowl. as well as the chairs. Prepare your treatment unit for the next treatment and equip the dentist and assistant element with the necessary instruments. After disinfecting the instrument tubing, including instruments and suction hoses, remove the detachable instruments for disinfection. Please note the instructions for the respective instrument in the care instructions. For cleaning and disinfecting surfaces, instrumentation and suction hoses, please use KaVo approved disinfectants. Now remove the suction hoses and clean them with Dekaseptol Gel. Use disinfection wipes to clean the upholstery of the patient's chair, the dentist element, the arm system, the treatment light, the monitor, the unit body including the spittoon bowl, as well as the chairs. Now spread the Dekaseptol gel into the spittoon bowl and then rinse it with water. Start the rinsing program O2 and place the germ reduction attachment on the spittoon bowl. Then insert the already cleaned instruments and suction hoses into the appropriate adapters. Now every instrument and suction hose is automatically rinsed for 2 minutes in accordance with the guidelines of the Robert Koch Institute. Once the cleaning program has been completed, leave the instruments and suction hoses in the germ reduction attachment and switch off the treatment unit by pressing the on-off button. The disinfection can now take effect overnight and on the next day of treatment. The cleaning program is started automatically once the treatment unit has been switched on. After disinfecting the instrument tubing, including instruments and suction hoses, remove the detachable instruments for disinfection. Please note the instructions for the respective instrument in the care instructions. For cleaning and disinfecting the surfaces, instrumentation and suction hoses, please use KaVo approved disinfectants. Use disinfection wipes to clean the assistant element. Now take the suction tubes and clean them with Dekaseptol gel. Use disinfection wipes to clean the upholstery of the patient's chair, the dentist element, the arm system, the treatment light, the monitor, the unit body including the spittoon bowl, as well as the chairs. Now spread the Dekaseptol gel into the spittoon bowl and then rinse it with water. Replace the sieve inserts of the suction hoses on a weekly basis. It is also recommended to grease the motors on the dentist element with silicone grease and to replace the back air filter underneath the dentist element. Place the germ reduction attachment on the spittoon bowl and start the intensive germ reduction by pressing the intensive sterilization button on the assistant element for more than 4 seconds until an acoustic signal sounds and the upper LED of the button flashes. Insert the already cleaned instruments and suction hoses into the appropriate adapters. Press the intensive disinfection button again. Now every instrument and suction hose is automatically rinsed in accordance with the guidelines of the Robert Koch Institute. And the water ducts are automatically filled with an increased concentration to Oxygenal 6. Once the cleaning program has been completed, leave the instruments and suction hoses in the germ reduction attachment and switch off the treatment unit using the on-off button. On the next day of treatment, the cleaning program is automatically started as soon as the treatment unit is switched on. It is recommended to remove and clean the silicone mats and handles of the dentist element, the handles of the treatment light, the instrument holder on the dentist element, the tumbler filler, the tumbler holder, as well as the spittoon bowl. The filling of the Dekaseptol gel bottle can be done with a 6-litre refill canister. If the Oxygenal 6 supply is required, an acoustic signal sounds in 10-second intervals. Now open the cover and remove the tumbler filler. Fill in a bottle of Oxygenal 6. The refilling is to stop immediately as soon as an acoustic signal sounds in the secondary cycle. Close the cover and insert the tumbler filler. As soon as the change of an amalgam container is required, a message with an acoustic signal will sound. Remove the cover on the side of the assistant element. Now unscrew the container from the amalgam separator and dispose the amalgam properly. Remove the new container from its packaging and put it into the holder. close the cover.